not allowed to smoke tobacco in hospitals, and you're sure not allowed to smoke crystal meth or fentanyl or other hard drugs. The challenge that we have is that rule is not being followed in some hospitals in some places.
After some confusion on a proposed policy requiring drug use spaces in all BC hospitals, Premier David Eby affirmed Tuesday that it wouldn't be happening. On Monday, Vancouver Coastal Health told City News that it didn't have any information about such a policy, even though Health Minister Adrian Dix told the Globe and Mail last week that it would be happening, only to later tell reporters the opposite.
There will be no province-wide mandate that every single hospital has to have an OPS or a consumption area. Because every single hospital doesn't have this issue. What we'll be focused on is how do we ensure that the rule is followed.
In a statement Tuesday, Dix told City News a task force was made last week to review rules in hospitals, focusing on safety while gathering ideas to support people addicted to drugs while in hospital. Some healthcare workers have recently spoken out about the challenges of working around open drug use. The BC Nurses Union did not respond to requests for interviews, but a statement from Hospital Employees Union spokesperson Lynn Weckert says, in part, the government's new task force to create province-wide standards will go some of the way to addressing the issue that health authorities have identified. The way forward requires empathy. In North Vancouver Tuesday morning, the Premier took numerous questions on the toxic drug crisis in BC, which is killing around 7 British Columbians a day, including if the province's response has been working.
But I think all of us recognize that the program needs to respond and evolve to the concerns of British Columbians and what we're seeing in community. That's why we brought in a set of rules around public drug use to say there are unacceptable areas for public drug use. We are in the unfortunate position of having been constrained and being able to apply that law by a decision out of the BC Supreme Court that says that we can't regulate hard drugs the same way we do alcohol or tobacco, which is an unusual decision, to be frank, and a troubling one for us.
Meanwhile, Brittany Graham with the Vancouver Area Network of Drug Users says she hopes the new task force looks at solutions to make hospitals better for everyone, instead of focusing on what she calls punitive solutions.
It would make sense that they then use their powers to create health services for people who use drugs in existing health services. It's a shame that that seems to not be happening, but I'm hoping that this is an example of moving forward, that the provincial government, who is in charge of health, continues to create health services for people who use drugs, like overdose prevention services, that we do not have enough of, and people are dying every day.
In Vancouver, Kier Junos, City News.